There we go. All right. Good afternoon, everybody, and thank you for joining us. My name is Adam Van Spankeren with Covering Wisconsin. I am the Navigator Program Manager, which means I get to work with a lot of really great folks and help kind of guide the efforts of enrollment assisters in the state and also kind of benefit from the experience of that community. I am joined by Nick Duke, and he is one of our veteran navigators in the Milwaukee area. He is going to be monitoring the Q&A because, as I've explained to the early birds who joined us, if I open any aspect of the Zoom overlay, it shows up as a shadowed silhouette on your screen, blocking the slides, which I hate. If anybody has any tech tips, I've tried just about everything and I've gotten help and nothing has worked. So if you do know how to fix that, if you've encountered that before, please just shoot me an email. That said, this has worked many times this way, and it's really great to have a support person. But yeah, this is our webinar on the special enrollment periods, tips and tricks of the trade, finding the right SEP, and CMS policy updates, and just policy updates in general here at the end that hopefully people will find useful. While you're here with us today, you can use the Q&A to ask your questions. As I said, Nick will go ahead and monitor that, and we will hopefully, so we'll stop periodically if we need to. Nick, you have full permission to interrupt me as I go, whether it's to to add a detail or anything that you think of that people should know that you think will be useful, or to chime in with any timely Q&A that we have, anything that is kind of on topic and we want to get into, because I will say we do have time. We've got plenty of time today, and I'm very excited to get into some of this stuff. We do have many members of that veteran navigator assister community that I mentioned on. So when we get to the Q&A at the end, we will actually go ahead and allow people the option. You can request to come off of mute and talk, and I'm happy to have a lively discussion on some of this stuff. And since this is taped over our normal affiliates call that I have with some members of this assister community, I'm quite confident we can have a really in-depth and educational discussion for anybody chiming in, and I hope that we facilitate a comfortable environment here for people to talk about this stuff, because it is really important and it is timely, and I think that it will help people do their work better. If anything else, I hope people walk away from the training today feeling a little more confident that there are options for the people that you're helping. You'll see a lot of different circumstances, a lot of people who need coverage during the year. We're now past open enrollment, and we'll see a lot of different circumstances. And there are, even just reviewing this, I've been doing this for a long time, and even just reviewing all the content, I am once again kind of taken aback and blown away by the breadth of options available to people. It just really depends on what they've got going on in their life, and really asking the right questions and then figuring out what opportunity they might have to enroll in coverage. So again, I'm the Navigator Program Manager for Covering Wisconsin. Elizabeth was going to be our Q&A facilitator. She has some family illness going on, so we wish her well and her family well and hope that everybody recovers soon. But I am very pleased to be joined by Nick here, Nick Duke, who is going to be helping me out. Nick, do you want to say anything, introduce yourself?
Hi, as Adam said, I'm Nick Duke. I'm one of the veteran navigators. I've been a navigator since the first open enrollment way back in 2013, I think, right? Yeah.
That sounds
So,
right.
I'm excited. Like Adam, every time I go through these things, I learn something new or remember something that I haven't had to deal with in a while. And it's nice to get it to the front of the brain again, as with all of the complicated things, it usually, it doesn't come up until it comes up. So,
Yeah, I think that's really well said. And there are people on who've been doing this work also for a long time, or even people who haven't been doing it as long, who will be more expert in some of these topics just because they had to do it to help somebody last week, for example. So I'm hoping that everything we have to share today is really edifying, but also if people have their own experiences that they think others will find valuable, that will kind of contribute to this enrollment workforce in the state, that they feel encouraged to chime in the Q&A or come off mute later as we get into some of this stuff. So today we are going to go over the basics of special enrollment periods. Not we're gonna be That's gonna be pretty brief, but we have plenty of time. We're just gonna cover some key concepts more than anything else before we really dive into sort of the bread and butter of special enrollment periods, and then hopefully spend a good deal of time on the uncommon steps. Although I think maybe as we get into it, we'll find that uncommon isn't even the right word because when you've been doing this long enough, you start to see a little bit of everything, and just knowing what's out there is what's gonna is having this information is gonna help you help people, and make sure that nobody misses an opportunity for coverage. Nick's gonna cover some other considerations, some things that kind of go hand in hand with this work that we do with signing people up for special enrollment periods. And then I will get into some policy updates before we have that kind of live Q&A at the end. So yeah, basics of special enrollment period, there's SEPs. I will try. Anybody feel free, if I use an acronym you don't know, call me out on it. But hopefully the ones that we're going to be using, SEP a lot, and minimum essential coverage, you will feel like pretty quickly here as we get into some of these key concepts and then build on that knowledge. So special enrollment period really basically refers to a life circumstance that generates an opportunity for somebody to enroll in health insurance coverage. We are going to be focusing almost exclusively on health insurance coverage through the federal health insurance marketplace. So this is all the special enrollment periods that were created by, with the marketplace, with the Affordable Care Act, as well as those that have come out of subsequent policy changes over the last decade. Which actually makes me feel old now that I've said it. And all the different opportunities that those will allow people who are, in many cases, losing other coverage, but other life circumstances that will allow them to get coverage in the marketplace, and especially if they're eligible for APTCs and can get tax credits to make that coverage affordable. So minimum essential coverage, MEC, I will more than likely say the whole thing every time, but we will talk about it as MEC and minimum essential coverage, basically refers to health insurance coverage that meets the minimum standards set by the Affordable Care Act. So you have coverage that qualifies. It basically, when I think of minimum essential coverage, I think of it meets all of the standards. It covers all of the things that the average person thinks health insurance should cover. So you're talking your hospital visits, you're talking, your prescriptions, emergency services, mental health, things like that. It meets all of these benchmarks set by the Affordable Care Act. And a lot of special enrollment periods, we'll talk about this in pretty shortly here actually, have requirements that you had minimum essential coverage previously. And that is something that's really good to remember because that makes it a little tricky for people who, maybe their life circumstances are making them think I need to get health insurance coverage or I need to make a change, but they might not have had that minimum essential coverage previously, and that can create a challenge or a barrier to somebody getting coverage through the marketplace. And that actually refers directly to our next bullet of that requirement of prior coverage. Typically, that prior coverage does need to be minimum essential coverage, but you'll see a lot of circumstances where if they want that special enrollment period, for that special enrollment period to work and to trigger, they need to have had coverage previously. Attestation versus verification. So as we do this work, you will see some language that we use throughout, whether or not somebody needs to verify a set of circumstances, which means typically send in documents. And, assisters on this call probably really familiar with this process, if not through the marketplace, certainly through Badger Care and other state programs where people have, the need to provide proof of income is probably the most common one, but also citizenship and immigration, other circumstances where the system or the state that is requesting proof of something that was said on the application. Easier than that is attestation, where if somebody is going to qualify for a specific set of circumstances that is a special enrollment period, all they have to do is attest, yes, this happened, I lost this coverage or what have you, and then the system doesn't follow up with a request for verification. We like that better. People being generally honest, that I think that's usually all it takes, and that means that's one barrier removed. That's one thing people don't have to deal with or worry about when they go to get health insurance coverage. So we prefer to see attestation, but we will talk about both today. Advanced availability is a really cool feature. It's probably something that we don't really think about when we do this work, because it just comes up in most special enrollment periods if people come to us in time. And that's that if you have a special enrollment period and coverage is ending, or somebody has that qualifying life event, if they take advantage of it before the end of that that minimum essential coverage, whatever circumstance it is, then they won't experience a gap in coverage. That's really what we like to see when people, you have to know that you need to take action. Obviously, when a special enrollment period typically through the marketplace, you've got 60 days, and we'll talk about cool new exceptions to that later. But if they can act before that, up to 60 days before that, they're going to be able to take advantage of the special enrollment period and get coverage without a gap, and that's ideal. Regular coverage dates versus accelerated effective dates. Typically, we see with the marketplace, your regular coverage dates. Again, we want that advanced availability, people taking advantage of that so they don't experience a gap. Otherwise, you see the regular coverage dates in the marketplace. If you're acting between the 1st and the 15th, you'll get coverage the first day of the month after. Or if you act after the 15th, you'll see it following in the following month after. Or accelerated effective dates, or some circumstances that pretty rare that you'll see that people can get coverage early or mid-month and things like that. That is very kind of less common. Nick will talk a little bit later about some circumstances where you can get overlap and not have to worry about kind of the dual coverage aspect of it. But really just kind of keep in mind that advanced availability piece as we do this. So the earlier people can take action and not have a gap in coverage, the better. That's really what we want to see. And as I was putting together the key concepts, the one that kind of stuck out for me is this last one, because it's something that I think, coming out of open enrollment, I'm not thinking about necessarily, but it is really, really important. And we'll talk about different plans and a lot of these special enrollment periods, that have this limitation on plan selection, and that is where somebody is changing marketplace plans, where they have a circumstance and they need to change later in the year, and they need to stay within that same tier, that bronze, silver, gold, platinum. They need to stay within that same tier. They can change plans. They have the circumstance. They can change their plan, for themselves, their family, what have you, but they need to stay within that same meta level. And a lot of times, if somebody is, sticking with a plan all year, like I said, during open enrollment, it doesn't come up as much, and we're not thinking about it quite as hard. But that a lot of those conversations are really kind of preemptive things. People want to plan for the year, and they say, what might happen this year, X, Y, Z. I might have this circumstance later. Will I be able to change my plan? And those conversations do happen during open enrollment. And you have to really inform people when they're choosing between, say, that really cheap bronze plan or that more expensive silver or gold, and what is going to work and what their care needs are. That, okay, if that thing happens that you just described to me, you're going to need to stick with the same meta level. So that, with that in mind, be thinking about your options and what is going to work and what's going to meet your needs, in July, in August, when that happens, and you need to make that change. So that is something that I do want people to kind of keep in mind as we do this work. It's just that limitation. People, you do have to stay within the same meta level, and it's one of those things that can be tricky to explain to consumers because it's a little arbitrary. There are kind of costs and plan design factors that kind of are the foundational reason for that limitation. But in terms of a consumer experience, it's pretty much arbitrary. It's just something that if you don't inform them about, they're probably not going to know and think that, okay, the system should work this way. I need to make a change. Can I make a change? And that is something that can hit them pretty hard if they need to change their plan. I do want to call it a really important resource. If anybody who was on today was on, I think Julia Garvey's with us. We did a training on special enrollment periods in 2022. I had to go back and find it as I was developing this one, and we talked a lot about health reform beyond the basics. And I, to this day, cannot recommend assisters to assisters enough that they become familiar with health reform beyond the basics and the different resources that they offer. It is an incredible wealth of regularly updated and really, really thorough resources for enrollment assisters on the different policy concepts, on the different questions that come up for us frequently, on the consumer experience. And we'll see some screenshots that I pulled from their special enrollment chart, which I've actually linked here on the screen. And when I send these slides out after with the evaluation and everything, you can use that. And the one reason I think everybody should have the special enrollment chart, anybody helping consumers should have this chart near them, is because a lot of the questions, the way this information is put together, questions that you're going to receive are questions that you just have as maybe even during this presentation you might have. I think that they're going, like, that chart might just have the answer very quickly, and you can save yourself a lot of time by familiarizing yourself with that resource. And it is I don't want to say mind-bogglingly because somebody figured it out, but it is incredibly thorough how many special enrollment periods, all the ones that we cover today, and as nuanced as they are, that are represented on that chart. So it is an incredibly thorough resource that I do want everybody to have and take advantage of and familiarize themselves with, because you'll see just the unwinding, loss of Medicaid, and CHIP, which we'll talk about in just a minute here. It refers really specifically, and it also has the requirement of prior coverage, which we've already talked about, and then plan selection limitations, and then also that generally granted by, which we're going to talk about, is fundamental to accessing these special enrollment periods. There is a difference between that attestation that we referred to. Somebody using the application just needs to say, yes, this happened, I qualify, that I meet this one requirement, versus something that they need to call the marketplace call center and explain the situation, get a human being, maybe a supervisor, and say, okay, this is the situation, and I do qualify for a special enrollment period. It's not one of these common ones, but I absolutely should have access to health insurance coverage. And we're going to talk about that in some detail later. So bread and butter steps, bread and butter special enrollment periods, we're really focusing on that loss of minimum essential coverage, that loss of coverage. The most common special enrollment period we see throughout the year is, I have had a change in job, a change in circumstance, or say my income went too high and I'm losing Medicaid. I have lost minimum essential coverage, and I now need to know what's available to me. And fortunately, again, thanks to the Affordable Care Act, healthcare.gov is there. People qualify for the special enrollment period. Typically, they have 60 days. Although with Medicaid, again, we'll talk about later, they are going to have 90. But there is one kind of big elephant in the room before we get to that, and that's the unwinding, which we'll talk about as well here. But I do want to focus mostly on special enrollment periods because we've all had a lot of unwinding in the last 6 months, and this is not that training. But the coverage loss must have been minimum essential coverage. So you're looking at things I mentioned, like job-based coverage. You're looking at Medicaid or Badge Care Plus. A lot of student health insurance. Student health insurance plans do count as MEC, although there are plenty of things that are like insurance offered through universities that don't necessarily meet those standards. But a lot of student health insurance plans do count if somebody is, say, leaving school and they're losing that student health insurance. And then COBRA. And Nick will go into kind of the nuances of COBRA, the loss of COBRA coverage or changing COBRA coverage, and things that are really important considerations for people who need to take COBRA, being their job coverage has, the employer contribution has essentially ended, or their job has ended, but they're allowed to continue taking that employer-sponsored coverage. There are some really key nuances that assisters need to know to help people in those situations, and we'll talk about those a little bit later. So having existing MEC is that an integral part of triggering these other special enrollment periods. We talked about that requirement of prior coverage. And then, yeah, signing up for a plan, healthcare.gov, before the coverage ends. I don't know how many times I'm going to say that today, but you really want to avoid a gap in coverage, which if you just take a look at, say, the unwinding, which we certainly will, people are being armed with as much information as possible to do their renewals at the right time, so they avoid the gap in coverage. That is the whole idea behind this sweet spot for enrollment. This don't enroll too early, because the reason for that is because they might lose coverage. And if they do that, they're going to need to know their options and take action before the coverage actually ends. So as I said, we get into the unwinding a little bit. Again, this is not the Medicaid unwinding training. We certainly can invite a lot of discussion on the unwinding when we get into the Q&A and the different implications this has. But what we're seeing right now is this period of incredible kind of re-enrollment or renewals for people who've been on Medicaid. throughout the public health emergency, because of the different policies that were put in place because of the PHE, the public health emergency, and the pandemic, people have had their badge of care, their Medicaid, and they haven't had to do renewals. But with that ending, a lot of people we're what, 6 months through it right now, maybe more, maybe 7. Medicaid unwinding SEP. There's actually a special enrollment period that a lot of people have taken advantage of over the course of the last year, where they are losing coverage, they're losing their Medicaid Badge of Care Plus coverage, and they don't need. There's not a specific time period. They don't have 60, or as I'll talk about in just a second, the 90 days. Anytime, all they need to do is in the application say, I lost coverage during this time. I lost Medicaid coverage, excuse me, during this time, and they can qualify for special enrollment period through the marketplace. So we're seeing a lot of that right now. So when I say we're seeing, the loss of coverage SEP is the most common. This is perhaps supersedes that, in that the Medicaid unwinding special enrollment period is really unique to this point in time, and potentially covers hundreds of thousands of people who are losing their Medicaid Badge of Care coverage, who were able to have it without renewing during the pandemic. New in 2024, losing that Medicaid coverage actually will result in a 90-day special enrollment period instead of the usual 60. So when I said it supersedes it, the Medicaid unwinding SEP doesn't really come into play right now, because people losing Medicaid are most of that is because of the Medicaid unwinding and the renewals. Although we do have people, now that we're far enough through it, we have people that could be losing Medicaid that aren't necessarily just because of the renewals, but they will have 90 days to get into the marketplace instead of the usual 60. So that is really, really cool. I do have the screenshot on the screen from, again, that Health Performance Beyond the Basic special enrollment chart. And it's any time between the end of March of last year and July of this year. So referring to the specific dates of the unwinding.
Adam, are we able to send out a link to the Beyond the Basics after the presentation to that?
Oh yeah, no, I absolutely will. And when I send out the slides, the links are live in here. But actually, Nick, if you just want to grab that link and send it out in the chat or the Q&A or whatever people see, go ahead.
Okay.
So I do think anyone who is kind of anyone who is having questions on some of the stuff, or wants to go into more detail that maybe I'm not necessarily hitting on, or the things that I'm focusing on, you have one other little question or one related question, and you just want to refer to the chart, that's absolutely something you can do. Certainly there is never too soon to familiarize with yourself with this resource as an assister. So other common special enrollment periods that we'll talk about, moving, people who, typically that, your circumstances, you change households. The one thing about moving is you need to change counties. Essentially, you're changing your provider networks. That's how everything within healthcare.gov is laid out, as I'm sure many of you are really familiar with. The different plans are available to each county. So you have to change your county, and then it might be something you stick with the same plan or provider network, but you do want your consumers to be aware of what that change of residence means, and of the new networks in the area, because maybe it's just one county over and it's not that big a deal, and they're able to see the same doctors. But if they move across the state, they may be looking at a vastly different provider network, different doctors, hospitals, and yeah, that is a pretty common one enrollment assisters experience, as people reach out to you, especially as you do this work for a while and you help people. You will see, people come back to you and say, kind of like I outlined that circumstance earlier, where someone's saying, hey, this thing might happen where I might move later in the year, something that people can think about in advance. Changing household size, birth, adoption, marriage, divorce, deaths, basically anything fundamentally changing the household size. You need to add or remove somebody from that coverage. That does qualify for special enrollment period, both within the marketplace and outside of it. And we'll talk a little bit briefly on kind of the employer-sponsored stuff, special enrollment periods at the end here. Change immigration status, typically that will make somebody newly eligible for coverage through the marketplace. That's a special enrollment period, or release from incarceration or jail. We'll see that as well. That will also trigger a special enrollment period.
And then we did just have a question about people who lose coverage from work. the time frame for their SEP for that?
Yeah, that's in here. I'm happy to say it now and repeat it later. So people who lose coverage from work, basically, if you lose your coverage from your job, you're going to have 60 days to get into the marketplace. So we talked about the Medicaid, kind of talked about Medicaid in some detail. You've got 90 days now, or you've got the window of this unwinding period. If you lose your job-based coverage, which is perhaps when the unwinding ends and things calm down a little bit, we'll see that probably is the most common step again. They have 60 days to get into the marketplace. Now, if you look at kind of the inverse of that, if people are losing their Medicaid coverage and they have an offer of work insurance, they actually have 60 days to get into their job-based coverage instead of what's more common is 30. If you're actually losing your Medicaid coverage and need to go to your work insurance, you have 60 days to do that as well. Hopefully that answered both versions of that question that I could think of. And if I did not hit the detail you wanted, I'm sure Nick can answer it in the Q&A. I see the little red boxes popping up as people have questions, and then I see them going away. So I'm just assuming that you're kind of crushing it in the Q&A, Nick.
I am trying to stay on top of it. We do have a hand raised. I don't know if they have a question they didn't put in the Q&A.
I'll say let's go ahead and say if you have a hand raised, we'll assume that means you want to come off mute and have actual discussion. We're going to save that level of discussion for the end, so please kind of save your question. You can also throw it in the Q&A, and maybe we can answer it there, and then we can talk about it more later. That's totally fine. Well, utilize the Q&A for now, and if you raise your hand, we'll assume you want to come off mute, and that'll be later. Okay, so uncommon SEPs. So we'll talk about uncommon special enrollment periods. These are the ones that I find endlessly fascinating and incredibly important as we do this work, because these are the ones where we have this incredibly robust and really, really experienced assister community in Wisconsin, and these are the ones where, hey, I have the circumstance, I've never seen it before. Can someone help me get this person covered through the marketplace? And there are a lot of different SEPs, a lot of different circumstances that do qualify somebody to get marketplace coverage. And they might be uncommon, but when you have enough of the people doing this work together, doing this work every day over the course of a year, you start to see some of them more commonly than others. So maybe some of these will be review for you. Maybe you did one last week, like I said earlier. But some of these will hopefully be new enough to you that you'll think when you see this later, you'll remember this and you'll go, I think there's a special enrollment period for that, and I can help.
And then Adam, there's just one more question that I think
Yeah,
would be more beneficial to answer live than me answering in the Q&A.
awesome.
Does the loss of Medicaid SEP mean you have 90 days from the loss of Medicaid, or that if you lost Medicaid at any time between 3/31/23 and 7/31/24, you can enroll in the plan? Example, Joel lost Badger Care August 30th. Can he still attest that he lost Medicaid and enroll now?
So that's basically blurring two special enrollment periods together, right? As I'm understanding the question, the application will allow somebody to attest that they lost coverage during that period, and that will just trigger the SEP on its own. So they would be using the unwinding one. The 90 days basically for loss of Medicaid coverage refers to the consumer experience outside of this period of the unwinding, essentially. The application through healthcare.gov isn't, I don't think, really making those distinctions that clearly. Whereas when the unwinding ends and those questions change and people are no longer saying, I lost coverage between X date and Y date, except for the open enrollment question that is on the marketplace website, it'll be 90 days. So 90 days from the loss of Medicaid coverage. So hopefully that clears that up a little bit. I'm happy to, I think that one could become a good discussion point later. I can imagine a couple different follow-up questions that people might have to that. These next ones we're going to talk about are related to income. I find them incredibly confusing. To be honest, I think that they interweave together in a really confusing way, but the net result of kind of looking at them and understanding them is that, wow, there are a lot of changes in income that will just result in a special enrollment period. So the low income special enrollment period, for example, went into effect in March of 2022, people can apply for this at any time without another qualifying life event. So even without the requirement of having that minimum essential coverage, people basically, if you're under 150% of the poverty level, you fall under that, but you are eligible for tax credits for APTCs, so advanced premium tax credits. This is allowing uninsured people to enroll with a special enrollment period through the marketplace. Now, this is only available right now. This is part of those, I think, the laws and policies that I was referencing earlier related to the pandemic. So this is through 2025. It could be expanded beyond that. But right, this is something that a lot of people can take advantage of right now, and it interplays really interestingly with the next two special enrollment periods we're going to talk about as well. Right. So these two, or in some case, I basically think of them the same in my head, to the point where even educating people on them, I'm fully prepared to kind of put my foot in my mouth and basically say that I think of these as the same, except for a couple fundamental differences that you can see in kind of the screenshot. The loss of the prior coverage is probably the biggest difference, but basically you have an income change that makes you newly eligible for tax credits. And for a lot of people, that's going from, so this is more applicable before that low income special enrollment period I just referenced. You have people becoming eligible for APTCs, typically going above 100 or 150% of the poverty level. They can, with one version, they're able to change their plan, and becoming eligible for APTCs. That might also be the less common version. It would be your income drops into the APTC range. We don't see that currently with the tax credits being offered at higher and higher income levels because of the policy changes that are currently in effect. But then you have moving out of the Medicaid coverage gap for a state like ours that did not expand Medicaid. So they were ineligible for APTCs solely because their income was below 100% of the poverty level, but they experience a change, an increase in income that is allowing them to become eligible for APTCs. So basically, if you have these fluctuations in income, and somebody didn't necessarily, for the second one, I think one of the most important things about it is you didn't have to have had Medicaid coverage. You just need to basically, your income needed to suddenly come out of Medicaid range to the point where you would be eligible for tax credits. That would allow you to get a special enrollment period. And these do have that requirement of that plan selection limitation, though, where if you are coming from marketplace, plan of not having a tax credit to having a tax credit, you do need to stick with the same meta level. And I think that is probably the trickiest aspect of these, because not having a tax credit and having a tax credit is going to probably be one of the biggest factors that are informing what plan somebody is picking through the marketplace. You're going to pick a very different plan probably if you're not offered a tax credit versus if you are. So if you become eligible for an APTC and you need to stay in the same meta level, that can, it really depends on the person's circumstance, what plan they had before. It might not be the one that they're hoping for. It might not be the best coverage that the APTC allows them to have, or the choice that they would make today versus the choice they made when they originally signed up for the marketplace. So we have one of the harder ones, I think, to talk about, but still incredibly important here, is that if somebody is a victim of domestic abuse or violence or spousal abandonment, they have every right to get a special enrollment period and enroll in a health plan that is separate from their abuser or their abandoner, and those dependents that are with them, they can be eligible for the special enrollment period as well. And a consumer, this is one of the few circumstances when the application, well, I won't say it's not, the application for healthcare.gov could be a lot more nuanced. But this is one of the circumstances where you will actually, if you're helping somebody with the circumstance, answer the question differently than you know how, and that is okay because that is the actual instruction that that healthcare.gov, that CMS gives. So they can answer unmarried even if they are still married to their abuser, their abandoner. There is a requirement of prior coverage. So they will have had to have had prior coverage, but there is no plan selection limitation. So they can change that meta level in this case. And that might be an incredibly important shift depending on, all of the other factors you could think of in a circumstance like this, the changes in income, the changes in household size with the dependents and things like that. So that plan selection limitation would have been a really potentially significant challenge in a circumstance like this. I really want to talk about the timing of this one. These are obviously really delicate, complex situations, and the consumer isn't necessarily restricted on when they can seek the special enrollment period. So it isn't like, somebody suffered this harrowing, tragic trauma that nobody should have to go through, and then suddenly they have 60 days to apply. That's not how this works. Somebody who is experiencing such hardship really has, a lot of factors they need to figure out for themselves, their families, their safety, et cetera. So the marketplace isn't necessarily restricting somebody on when they can access that special enrollment period. When that person decides they need to seek or change their health insurance, when that becomes the priority for them, they can get the special enrollment period. They will need to call the marketplace and access it that way. But I have done this for a few different people, and the timing has never been a factor. I think one time I don't think I had to appeal it. I think I talked to a supervisor or a specialist. I don't believe I had to go through with an appeal to make it work, but we did have to explain the situation through the call center representative and get it activated that way. But it did work, and it was well past kind of the height of the trauma that this person experienced, but it was when they could finally settle down and think about their marketplace coverage again. We were able to take advantage of the special enrollment period. So unexpected situations, that's such a broad bucket to talk about. But this covers a few different things, and we saw kind of a big surge or emphasis around this in the past couple of years. But it's still very much a thing. There is kind of a trick with attesting to these. But so I'm just going to talk about these bullets very briefly, and then sort of explain the how these work. So if you had an unexpected hospitalization or a temporary cognitive disability, something that really incapacitated somebody. And this especially, the reason I said this became sort of an emphasized thing within the last few years is because it included COVID-19, right? If COVID-19 hospitalized you, you had very little chance that you were going to get out and talk to an enrollment assistant. I mean, you probably very well fighting for your life. And similarly, if you experience a natural disaster, but that disaster does have to be a disaster as defined by the Federal Emergency Management Agency or FEMA. And then the really key thing to these is that the event must have prevented somebody from enrolling during open enrollment or another SEP, another special enrollment period that we talked about. So somebody had, say, their 60 days to enroll, and they were at the end of that 60 days, and something happened. They were hospitalized, or there was a disaster in the state. I have to check to see if like winter storms count, because they very well might. So like say the power went out and they couldn't access and their computer, they couldn't apply online, the phone lines down, whatever it is. If it was a disaster that affected them during that time, if it was a health condition that affected them during that time and prevented them from enrolling, they do get another special enrollment period for that. It's kind of interesting. Somebody like doesn't necessarily need to have been in the middle of doing their marketplace application. Really, and I think that's fair, right? Because there's a difference between I knew I needed to apply. I needed to apply by the end of the month. There's no requirement that they had to have had started their marketplace application, so much as that window of time elapsed because they couldn't do XYZ. And I think I've even seen, like I've argued, I think on appeals, where I've said the person wanted and needed help of an assister, and they have that right through the Navigator program, and they couldn't get help because of the condition or circumstance that they were experiencing, and we were able to get them a SEP. These do require a call, as do the previous ones, to call the marketplace call center and attest, yes, this happened, this is a situation. Sometimes this requires talking to a supervisor or a tier 2 specialist, what's known as a tier 2 specialist. Call center reps don't often or always love when you ask to talk to a supervisor, as you may know, but that is every person's right to get the best help and the most knowledgeable person at that call center. All right, Nick, I think I asked you to cover the American Indian or Alaska Native one because I think you have done this more than me, certainly more than me.
Yeah. And then I do just have two quick Q&As before I get
Sure.
into that.
Yeah.
The first one, for the 150% of the FPL SEP, we are still currently using the 2023 FPL chart. Yes.
Yes. Yeah. For this whole year, we would be using the 2023 chart. That is correct. That's a good
And
question too.
then someone asked for the domestic violence SEP, does that auto disenroll them from their previous family plan with their spouse?
Ooh, that is a really great question. And one that I will fully admit that I do not know the answer to. I believe in the cases that I have done it, I was typically generating a whole new application. Um, so that is a really great question because you would need to do that and make sure they're not dual enrolled, obviously. Um, that is certainly something that if I was doing this, say, today or tomorrow and helping somebody with that situation, I would double check with the call center. If anybody's done it more recently than me and remembers that answer, please, please, please chime in with that because now I want to know that because that is a great question.
Yeah, I agree. I don't know that I've done it recently enough to know the answer to that, but it is a
Yeah,
really good
yeah.
question.
I mean, it's fundamental, right? It's really really critical to that situation, especially when you think about doing taxes and reconciling health insurance, things like that at the end of the year.
Yeah. All right. And then I'm hoping everyone can hear me. There was something about me being a little muffled at the beginning. Um, oh, and yeah, the question we were just answering was about enrolling for the domestic violence SEP, if that automatically disenrolls them from their previous family coverage. And that is an answer that we will take back and hopefully be able to send out to everyone.
Yeah, well said.
Mhm. So the American Indian or Alaskan Native SEP, this is a really great one for anyone who is tribally enrolled and eligible for this. They can use it anytime during the year. It does not have that same requirement for having previous coverage, so they can decide to get coverage at any point. Um, and not that I recommend it, but technically they can change plans every month if they want to. Or if they realize they're unhappy with some aspect of their plan, they do have that ability to change it at any point during the year, which can be really nice, especially if they take a bronze plan or a lower plan and have something unexpected come up, or find out that the plan they chose isn't covering one of their providers or something like that. It is a nice thing to be able to do. And they do have to be tribally enrolled, so they would have to have documentation by a federally recognized tribe. So whether that be a tribal ID or some form of documentation that they are in fact a tribal member. And I think one of the biggest perks of this SEP is that if they are between 100 and 300% of the federal poverty level, they can get zero cost sharing. So that meaning whatever their premium is, that is the only out of pocket cost for the plan that they will have. So that is really nice. It allows individuals who are eligible and are members of federally recognized tribes to select less expensive, possibly bronze plans that would generally have much higher deductibles. But because of this provision in the law, they don't have that deductible. So they are just paying that lower monthly premium. Um, Adam's right, I've done a lot of these. And I would say one of the nuanced things is if someone in the family is tribally enrolled, you can create the healthcare.gov application in that individual's name. So if the children are tribally enrolled, but the parent that is the custodial parent is not, that custodial parent would not be eligible for coverage. However, you can create the application in the child's name and you can get the children coverage at any point during the year with this SEP. Uh, Similar in the way that other SEPs or other plans will give you groups and say this individual is eligible for this, this one is eligible for this. That's what will happen. It'll tell you that whoever is tribally enrolled will be eligible for the special enrollment and can choose a plan, and whoever does not have the documentation to show they are tribally enrolled would not be. But it is nice to know. I dealt with a lot of families where the custodial parent was not tribally enrolled, or they were with someone else who wasn't, they were with grandma or a guardian. You can create the application in the tribal member's name, even if that tribal member is the child. And that allows you to get this special enrollment to move forward.
No, go
Go
ahead,
ahead,
Nick.
Adam.
Go ahead. No, you please. I value your experience on this.
And then just kind of a side note about this too. I know a lot of individuals, and I'm not sure how many people work with the Native American community regularly, but a lot of individuals in the Native American community like to say that they are covered with their IHS facilities and the health centers on the reservations, which are great. But I always like to tell people that those are great, but what happens if you're somewhere where that's not available? So that's kind of how I've gone about this in the past. When I was doing this a lot more regularly than I currently am, I would always like to ask people, okay, well, what happens if you get hit by a bus on Sunday? The IHS facility isn't open on Sunday. So you're going to go to a hospital. So if you do find that you have some resistance to individuals wanting to sign up for coverage within the Native American community, you can kind of probe a little bit that, well, what they have available to them is great. Also having coverage is always just a nice kind of extra piece of security for that.
Awesome. Yeah, no, that's funny. You just made me think that, man, buses get a really bad rap. I use them in a lot of my examples. You get
Well,
hit by a bus example.
I was actually hit by a bus when I was 17. So
Holy cow.
I was driving. I was in a vehicle. So
Okay, okay, cool, okay. But you get to use that example basically. So I got it. Okay.
but yeah, I
Awesome.
use it all the time. It's great.
Okay. Well, thank you, Nick. I appreciate it. Um, okay, I still see some hands up, but again, we'll get to the kind of live Q&A towards the end, and we can discuss to whatever extent, whatever detail people want. I'm looking forward to it actually. But I really need to talk about misrepresentation because it is something that is becoming increasingly common. Misrepresentation is this very broadly defined category. You might, two other ways to think about it are like scams. And the more kind of useful shorthand that I like to think of it is like, it when you see it, right? These typically you'll see these happen like this time of year, like right now. And actually we saw a lot of fraud and misrepresentation during open enrollment. As well this last year, just because we have a lot of out-of-state actors signing people up. But we'll see it. What we'll need to trigger the special enrollment period right now after OE, because it's when people go to use their coverage or they go to pick up their prescription and they realize that the plan that they have or they thought they had isn't what they expected. So these can include a lot of what we saw this last OE, which was somebody enrolling a consumer in a marketplace plan that just does not meet their need. It doesn't have the right provider network. It is not at all what they were pitched on when signing up for the plan. They were given, they were the victim of misrepresentation. They were given bad information. I think we see that more commonly now, but what I used to do a lot of these for was during open enrollment, you'd have, similar bad actors signing people up for plans or insurance, products. So I hate that terminology, but insurance products that don't meet minimum essential coverage. So, you've got like these short-term limited duration plans, things like that, things that look like minimum essential coverage or things that look like health insurance, but aren't. But you have these things where, especially during open enrollment, they get marketed to consumers who are actively looking for health insurance. Now, this circumstance will trigger a special enrollment period. Somebody can then change their plan or get a special enrollment period if they say they didn't get even into the marketplace. They got some other type of insurance or short-term plan or something. They can then use that and get a special enrollment period. The effective date may vary. I have seen these backdating anything to the marketplace is incredibly hard and nuanced. But based on the nature of the inaction or the action taken, these can also go to appeal. And usually, when you're looking at backdating to the marketplace, that's like oftentimes to get backdating to work right, you will need to do something like an appeal. That is one of the only ways that like really guarantees that you get the effective date that you need. But based on the nature of the misrepresentation or the inaction that was taken, then your effective date can vary. Ideally, this is something that somebody catches before they end up in financial dire straits and can just fix. Ideally, this is something we see and we can fix it before it gets out of hand. But that bus example, somebody ends up in the emergency room and thinks that they have health insurance, so they're not concerned, but then finds out they were signed up for something else. Then we're looking at a really complex situation and maybe an appeal and all kinds of things. So these can be tricky, but that special enrollment period does exist, and I want everybody to be aware of the level of fraud, the number of bad actors out there where you may need to take advantage of this in more than ever this year. Similarly, but certainly less nefariously, we see errors and mistakes that can also generate special enrollment periods. Technical error with the marketplace website is when I think error, I typically think like, okay, something went wrong. And you can see this when like the marketplace website goes down or something like that, preventing somebody from enrolling, or they enrolled but the data transfer to the health plan didn't work. Something prevented the health plan from getting their information. These can be really hard to verify though. And again, sometimes you'll need an appeal to actually make that work, but there is a special enrollment period for getting an error. Similarly, but differently. So an honest mistake, if a navigator or an agent or a broker or another system makes a mistake on an application, so they're working with a consumer, they're attempting to assist somebody, and they're doing their best, they're using all the best available information to them, but they God forbid you make a mistake and somebody gets signed up for something wrong, or something is entered incorrectly, or something happens and it is, the assister's fault. They can actually qualify for a special enrollment period to make that change or fix that situation, whatever it is. I haven't seen a situation, and actually I did a poll of navigators a couple of years ago now to see if anybody had found themselves in the situation and if there were any punitive actions taken. And I don't believe, a mistake is a mistake. It's not, it's really bad actors and bad intentions that are policed by OCI and CMS and things like that. So I just want people to know that some mistakes can be fixed. They can result in special enrollment period and qualify somebody for different marketplace coverage.
And Adam, I'll say I've used that before, even if it wasn't actually my mistake. If they've come to me after they've had the issue,
sure,
just to get them the special enrollment period, and I've never had any backlash on the back end or anything towards me about that. So it's not something that you should be nervous about, I don't think.
Right.
Mistakes are mistakes. And then I did have a question that I think would be really good for a lot of people. How do you prove misrepresentation? For example, Anthem Pathway is not in network with Aurora, which I think those of us in this area are pretty familiar with at this point.
Sure.
But the patient is an Aurora patient, and they should have gotten Anthem Blue preferred.
Interesting. So ways that Nick, maybe you have some thoughts on that specific example, but ways that I prove misrepresentation, a lot of it comes down to like the consumer attested experience, where I will get an account of what happened from the consumer, and I will be writing it in the appeal and explaining what happened. I don't think I have ever had, I mean, maybe this just speaks to kind of gauging successfully or correctly when an appeal is necessary. But I don't think I've ever had an attestation from a consumer not go over well or not be interpreted generously on appeal. And I'm sure that there are people in in this group that are like, I have, that's awful. But I mean, usually, so an account of that, typically, if there is any information on the plans that they were shown, like if they have, any sort of, this is what I thought I was being signed up for, this is the documentation or the emails I received, anything in that chain of communication can be really valuable to say, like, look, this is what I was shown, and this is, clearly misleading. You can tell what the consumer was thinking or what they were meant to think in that situation. Usually that will do it on appeal, or even, hopefully it doesn't get to that point and you can explain it to the call center rep. You will also have, if you go through the steps of doing, say, an OCI complaint, where OCI does an investigation and actually looks up the agent or broker or sister that helped them and gets some more information, you could, in theory, get some other information or documentation that may be valuable for proving misrepresentation through those channels as well. So I do recommend that anybody who is, who suffered misrepresentation or signed up for something that they did not want or did not need or thought was something else, actually go through the step of doing an OCI complaint. So it is kind of broad. It all starts with that kind of consumer account of what happened, because it can be difficult to prove that, right? And like a lot of these other things, I mean, I think I've had a harder time proving that something went wrong with the website than I have from a consumer just saying, this is what I thought was happening, this person did not do a good job, or this person, signed me up for the wrong thing. So successfully accessing these uncommon special enrollment periods. So I mentioned this with several of them, but a lot of these have to be triggered using the Marketplace call center and explaining and attesting the corresponding situation. And as I said, for a lot of these individually, a lot of these can require an appeal. Again, the cool thing about the appeal is that it can get you to go back and get the effective date that you needed, or that they should have had in the first place. And then just a tip for people who do this work. I really think that, if you've done your homework, you've helped this consumer, you've gathered all this information. If the marketplace representative isn't giving you the answer that you expect, and they haven't explained circumstances in a way where you are dissuaded, you still are pretty sure you're right and you feel good about that, call back. Talk to somebody else. You talk to that supervisor, talk to that tier 2 specialist, but sometimes you just start over, because you might get somebody who is better informed, who has more experience, who is more familiar with these other special enrollment periods and these circumstances, or who just seems to have a better grasp on the situation. I mean, call centers have high turnover, and sometimes you just need to talk to the right person. So don't be afraid to call back and get somebody else to call center, and start there before, say, launching an appeal. Just start with the path of least resistance first. I do want to talk about this, and this might be something that evolves in the actual discussion we have here at the end, because this is very timely, right? We have 2 hospitals and 19 clinics closing in Western Wisconsin, in the Chippewa and Eau Claire area. We've got the Previa Health Systems, and we've got these closures happening. And Julia Garvey actually brought this to my attention when she was researching, and I wanted to bring this to this group because I thought the answer, when, I think, Julia, you can chime in later, but reached out to Health Reform Beyond the Basics, I thought the answer was kind of wild, and it was kind of unexpected, where you've got health systems closing, so people will no longer have access to the provider networks they thought that they were signing up for. So basically, the health insurance, the health plan, the services they thought that they were signing up for, did sign up for, not even just thought, they did sign up for during open enrollment. Those changed beyond the consumer's control. And then there is no specific special enrollment period for that. That kind of shocked me. And I will say that there may be other mechanisms in play, other things that will come to fruition here over the next few weeks. I say that because I know that OCI, DHS, the state are looking at this situation in its entirety and the gravity of it. And we are expecting some kind of public announcement. I'm hoping that OCI, in charge of kind of monitoring these different provider networks, can look and say these provider networks are no longer sufficient or XYZ, that they have kind of administrative or executive authority that I am, as of right now, unaware of, and it can do more to fix the situation. So this is just very timely, and I really wanted to bring to this group, and I will put out a call to sisters. I think kind of Sue Lane and her crew, I think, are talking about the kind of the rapid response element of this right now. Rapid response, for people who don't know, is kind of the unofficial official term for when sisters work with like unemployment and workforce development and things like that when there are layoffs and things like that. So I do want sisters in the area to be aware whenever there's a closing at this scale, that those people who are being laid off may need health insurance and may need these special enrollment periods. And if they're losing health insurance coverage, you put together a rapid response and you educate and you let people know that there are sisters available to help. But there are people who are affected by the actual health systems closing that may be able to take advantage of other special enrollment periods, like the low income SEP, depending on, again, their personal circumstances. And we may be able to help them kind of in spite of everything else. Because again, I think it's wild that there wouldn't be an official kind of mechanism for getting these people coverage when your provider network changes. That said, again, I just want to say I'm hoping for some sort of positive or effective news from OCI and DHS or someone in the next few weeks on the situation. So we will see what happens. I'm really hoping that there are some mechanisms that I am currently unaware of that will help get these people special enrollment periods or whatever they need to make sure that they can still access providers, because that's a huge problem. So just summarizing, I just want people to remember the special enrollment periods that don't require prior coverage. We talked about these, but just looking at them in aggregate here. So we've got the low income SEP, doesn't require prior coverage. That was the one difference from that one from those other really, really similar income related ones and eligible for APTC ones. Birth or adoption or placement for adoption or foster care. Those can qualify somebody if they didn't have prior coverage. Newly gaining eligible immigration status, that makes sense. Nick went into nice detail on the American Indian or Alaska Native special enrollment periods. Being determined ineligible for Medicaid can. The error, misrepresentation, inaction, or misconduct one is actually kind of really interesting because we have seen circumstances now in the last year, and I hadn't previously, where somebody got a special enrollment period because of misrepresentation to begin with, and for some reason they were able to get coverage. But that circumstance in of itself, that misrepresentation does qualify them for a special enrollment period. So even if they shouldn't have had one before, the fact that they were misled, and especially if they paid for enrollment services, which you should never have to do, that can actually trigger a special enrollment period, even if again you didn't have prior coverage. They should, that's a really terrible situation, and they should take advantage of that, and you can help them kind of make themselves whole and get some real coverage. Those exceptional circumstances and the FEMA SEP, but again, keeping in mind that those typically have to overlap with somebody trying to, or the window of applying for coverage being missed because of those circumstances. But they didn't have to have prior coverage. They just needed to have missed that window because of what happened. So Nick's going to talk about some other considerations, some really important kind of details and food for thought about accessing SEPs and verifying SEPs and things like that. So I'm going to turn it over to Nick, and we will get to those policy updates and then Q&A.
Okay. So the first one that we want to go over is losing coverage mid-month. So when you have a consumer who's going to be losing coverage mid-month, you do want to make sure that they are taking action to get their SEP before the final half month of their coverage. So as the slide says, for example, if they're losing coverage February 11th, we want them to select a plan by January 31st. And that means that they will have dual coverage for those 11 days. But what Adam mentioned earlier, that's one of those dual coverages that's okay. They can, those few weeks is fine. Otherwise, what would happen is they would sign up for a plan February 11th and the coverage wouldn't begin until March 1st. So they would be without coverage for the last half of February. So if someone is losing coverage mid-month, they want to take action the month before that they're losing it. And that does not affect their APTCs or cost sharing or anything. We don't want them to have a gap in coverage. Cobra, everybody's favorite, right? So Cobra has some interesting nuances. The first one being that if a consumer elects Cobra, they are not eligible for an SEP later in the year. Meaning, if they elect Cobra and they wait out their original SEP time period and then decide that they want to cancel the Cobra, that is not considered losing coverage because they're actively canceling coverage. They're not losing it. So that would not create a special enrollment period for them. However, if they elect Cobra and then decide that they don't want to continue Cobra while they're still within the original 60 days, then they can cancel the Cobra and still get on the marketplace because they're within the original SEP time period. So that's an important one that I think a lot of people don't realize. You can't just decide to end Cobra and get an SEP. If Cobra ends, that's different. That would create an SEP. So if they've run out their Cobra, that's different than them canceling it. And so then that would create an SEP. Or if the employer stops paying their portion, or well, the employer doesn't pay for Cobra, but if it goes up, if the price increases dramatically, which they don't give a specific number, so that's also kind of one of those ones. I think similar to the misrepresentation SEP, if you can get the marketplace to consider whatever that increase is to be dramatic, you could possibly get the consumer an SEP that way. They don't give specifics on what dramatic means. You know, dramatic could be $1 increase to a consumer. I mean, I think it'll have to be higher than that, but but if you're really, really good at getting your point across and you can get the marketplace to consider $1 dramatic, I would love to hear about it.
I will say I have not seen that version of it, Nick, but it would be an interesting little experiment.
And then lastly, if the consumer does elect Cobra and they are out of their original open or special enrollment period, they would have to wait until the next open enrollment, unless one of those other things is true or they're eligible for some other form of SEP. And then this one, again, I think it goes hand in hand with some of the misrepresentation is the junk plans and other coverage. We sometimes get a lot of consumers who sign up for short-term plans or limited duration plans, things like that, that are not considered minimum essential coverage. And the unfortunate thing about that is losing those plans or ending that coverage does not trigger an SEP. So they may call you thinking that they're losing coverage. However, if their coverage didn't meet the guidelines for minimum essential coverage, that does not trigger an SEP. So it is important to let consumers know that not all plans meet the minimum essential coverage, and therefore not losing all plans does not trigger an SEP. And then verification. I've noticed lately a big shift that I have not been asked for a lot of verification at all. This last OE, I think maybe less than 10 of my consumers were asked for some type of verification. However, they can pick a plan prior to submitting the proof, but their plan will not start until the verification is verified. That's a weird sentence. Until the verification is received by the marketplace. And this happens sometimes just because of data matching issues or technical issues within the application. However, once the verification is in, then they should be allowed to complete the SEP, get their plan, have their plan start.
Yeah, that's a really good point too. We talked obviously a lot to our Navigator network, and it's just true. The trend in the marketplace, at least, is erring away from verification, which is it's great for consumers and the people we help, and that's one fewer thing they need to do, one less barrier in their way for coverage. That's awesome.
I agree. Yeah. Okay. And then Medicare. Medicare, again, has some of its own ins and outs. Medicare is not something that we as navigators or assisters necessarily deal with, except for in the case of someone in the home being Medicare eligible while others are not, and we're assisting those others getting coverage. And when that happens, it can be things like if the primary applicant in the marketplace becomes eligible for Medicare, ending the coverage, you can end it on healthcare.gov in their account. I personally like to call to end the Medicare coverage. It seems to go a little bit smoother. And what you want to do is you want to end the coverage the last day of the month before the Medicare starts. So if their Medicare is going to start on March 1st, you would want to end that coverage February 28th, 28th this year. Yeah. Oh.
We get a 29th this year, actually.
Oh, 29th.
Just this year, happens to be.
Yeah, there you go. But yeah, like I said, you can put a date in the healthcare.gov application to end the coverage. You can go in there and select a coverage end date and select the date. My best practice, as I said, though, is I like to call the call center with the consumer and end the coverage through the call center. That has seemed to work the best and been the least complicated way for me to end someone's coverage who is transitioning to Medicare.
Yeah, I really like that tip as well, Nick. That's really good because the system, isn't this. I mean, the fact that Nick just explained this and it doesn't seem to make a lot of sense remains an issue, right? Like it should not be this hard.
Yeah. Yeah.
Yeah.
That is
So yeah,
my biggest tip is
I
you
think
can
that's
do
right.
it online, but I recommend calling for this specific instance.
Awesome.
And I don't recommend calling for a lot. I don't like call
Yeah.
centers if I can avoid it. So
Yes, I agree with that, Nick, as well. I don't recommend calling for a lot, although I did emphasize, I did have a huge section of this presentation where I talked about all the circumstances which you would want to call. So there are a lot of things you don't need to call for, but special enrollment periods, some of these trickier ones, yeah, you do want to call.
and we do have someone in the Q&A mentioned, and I have not had to do this in a minute, but I guess they did change it, and you can take the primary person off of the coverage due to Medicare on the marketplace now on
Okay,
the
cool.
application. So that's great. That does make it quite a bit easier.
Yeah, no, that's awesome. I anything that improves that really cumbersome, non-intuitive process, anything that's not intuitive. I mean, even for an enrollment assister, I mean, it's not going to be easily understood by somebody trying to do it on their own. And those are the people that I fear the most for, the people that I want to help the most in navigating insurance and healthcare.gov. So yeah, thank you for that. Again, this is exactly what we're talking about. If you've had to do it more recently than us, then that's something that is readily available, knowledge that's readily available to you. And I thank you for sharing it. I'm going to talk through briefly here some policy updates, so we have a little bit of time left for Q&A. Nothing earth-shattering, but some pretty cool stuff nonetheless. Just a reminder, because it seems like it's been a while since I mentioned it at the beginning, the 90-day special enrollment period for people losing Medicaid coverage really going to come into play after this unwinding period. The marketplace has also this newer one automated a 60-day extension to resolve data matching issues, actually specifically related to income, which is on top of a kind of a 90-day period for resolving data matching issues. So there's an extra 60 for a total of like 150 days. two thoughts that I have on that is, one, I don't want anything with health insurance and signing up to take that long. So hopefully it's not necessary for a lot of people. But yeah, I think maybe I'll just one thing. I'll leave it at that. Although maybe when I see automated, I get nervous because I've been doing this a long time, and whether it's the marketplace healthcare.gov or the state, I always need to see it work for a while before I'm happy with it. But hopefully it goes really swimmingly, and it just helps people as they're trying to resolve these income related data matching issues. And that,
Did they
yeah.
go into detail on that? If that means that they will backdate this 60 days for the coverage?
I will have to check. We can check on that, because the last thing I was looking at before, when I was putting the slides together, didn't say exactly what that meant. But I know that Health Reform Beyond the Basics put something together, and I would like to think that they answered that question, because that's that's kind of key to what we do. So maybe we can even find out during the Q&A here and get the answer before the end. And then, yeah, Nick, if you want to even see if you could find that answer quick, I know Health Reform Beyond the Basics has something on there. And then the last one here from CMS, this is new for, I guess, end of last year going into this year. Navigators and assisters can conduct door-to-door outreach, actually not only outreach, but enrollment. So other unsolicited means of direct contact to provide enrollment assistance. This is one that, okay, is, it was previously strictly prohibited, like explicitly, you can't do this. This is not necessarily the best means of conducting this work, or the way that we will want to do this work. But I think the unsolicited means of direct contact is probably the most interesting, because it means we might be able to reach more people and let them know about Navigator services. But at the same time, I worry, as we have long tried to educate our consumers and instill a certain level of wariness about, say, these bad actors that I referenced earlier. You want to be really careful. I don't anticipate going to a door-to-door model for navigators, but maybe when it's really nice in the spring and summer, that's something we'll want to do. And then some other policy updates. Again, talked about it a while ago, but reminder for a special enrollment period for job-based coverage for Medicaid. If you're losing Medicaid, you've got 60 days instead of 30. You may find yourself in a situation this year where you need to inform an employer of that. The nature of employment and small employers or larger HR, departments, things like that. The knowledge of or previous experience with special enrollment periods for losing Medicaid, it's an unknown, right? So you may find yourself needing to inform employers on behalf of consumers about that they have 60 days instead of 30 days. That is under the HIPAA Act, actually. And then this newer one from DHS is this 12-month continuous eligibility for children. So children under 19 who were enrolled in qualifying programs as of January 1st. But then the family experiences a change that would make them ineligible. Typically, we're thinking income. Most of what I've seen on this has been related to income, but there are other changes that this would still come into play. They will have 12 months of continuous coverage. And it includes programs, so like we've got programs like Katie Beckett, but also I think really coolly emergency services, where that because emergency services being for non-qualifying immigrants, where that coverage could then continue into the new year. That is kind of reminiscent of the pandemic policies that were in place, and I really like that change. DHS fact sheet on this is actually really good. I was looking at it, and so we did include a link to that here. I think they did a really nice job. They did explain on there. I know some of the exceptions are on there as well. So turning 19, that can end at this period because that person is no longer that child under 19, so no longer qualifying that way. Moving out of Wisconsin. If citizenship or immigration status isn't verified, or the individual or family, or just in this case, family could ask to end that coverage early too. So there are some exceptions, but otherwise, this is a pretty cool change. And I do just want to highlight one thing that's important, really important for members who are children have a premium. Yes, they will be getting kind of that. It won't be a rolling monthly savings like a coupon that says you need to pay your premium, but there isn't necessarily a loss of coverage for not paying that premium. The federal law in this case supersedes the state law. So the state law requires that they ask for that payment, but the federal law says you can't end the coverage. So if they don't pay that premium, if they can't pay that premium, they will actually they'll be able to continue that coverage, which is very good. And then MAP, maybe you saw this through the GHS task force. I think it's the most recent place I saw the information about MAP, so the Medicaid purchase plan. The work requirements are back in effect. The premium payments are still paused. But well, I'm sure we'll be hearing more about that in the not distant future.
Yeah, and then Adam, what I saw on the Beyond the Basics about that 60-day automatic extension was effective date appropriate for circumstances. That was the answer.
I remember that reading that exact. Now that you say it, I remember reading that exact language, and that's probably why it didn't get filed away well in my head, because that's not super helpful yet, is it?
Not so much, but hopefully we'll get some better answers from that. And then
I hope we get some answers and some experience as people encounter it. You know, I would like to see more backdating in every arena, and marketplace backdating is tricky. So I hope it works well.
Yeah. And then Julia Garvey had a comment that there is no 15th of the month rule anymore. So all SEP plan selections start the following month. So it's just something to keep in mind when you're reporting for a future step.
Oh yeah. No, I did mention that at the beginning. It's not actually written in the slide, but yeah, I was talking in those older terms. So thank you, Julia. That is helpful. And yes, that also, you know, we want to avoid gaps in coverage, and that is a good rule to know. Absolutely. And yeah, keeping up with these changes can be tricky. So hopefully this was really helpful and edifying for the folks that joined us today and the folks that watch it recorded. We do have 5-6 minutes left, and we are at time for questions. And I would love to be able to, anyone who had their hand up earlier or wants to come off mute and actually have a discussion, I am happy to do that. I see Mary Reinschmidt has had her hand up off and on or throughout this whole thing, and if anyone deserves to ask a question, it's got to be Mary. I'm going to stop sharing so I can actually see the rest of this interface without these black boxes. So, all right. So Mary, you can come off if you want to talk. Otherwise, I'm sure if you had the question earlier and you wanted to put it into the chat, that's fine. Otherwise, I think I saw Mike's hand as well.
Yes, my question has been answered. Thank you.
Oh, good. That makes me happy. That means we're doing our job right. Thank you. Okay, cool. And then I'm going to let Mike chime in because Mike always has really interesting stuff to say, or he throws me curveballs that I regret letting him talk. No,
not the case. I haven't seen all of the typical controls in the screen today, and I apologize. I couldn't join until late.
Okay.
But one of the things about the transition for one spouse to Medicare that I've encountered is the astonishing increase in premium costs for the remaining spouse on the marketplace plan.
Mm.
What I've encountered is just the last case, the couple together were paying a premium of $235. When the husband went on Medicare, the wife had to pay over $400 for her premium.
Yeah.
Are other people encountering this? And let me just append that with, because we had foreseen something like this, we tried to do this transition during open enrollment.
Mm-hmm.
And we're told by the marketplace agents, several in a row, that we could not terminate the Medicare bound spouses coverage early. Yep. only terminate it the last day. So I mean, that was confounding because it doesn't seem like that should be the rule. But the problem is that the spouse doesn't seem to be able to change plans and is hit with essentially double the premium. So that's all.
Yeah, no. Well, two things. One, yes, I thank you for underscoring that with your own kind of recent experience, because again, like you, I find that system bizarre and baffling. And I know somebody said, hey, you can actually take the Medicare bound spouse off the application now, and like that should help. But you really hit on something that I think is really important for people to know, that if I had thought a little bit more about it, I probably would have worked it into this training, is about keeping in mind what happens when you change coverage. That, you know, the prices, you have to reassess the prices, and a lot of times those coverage changes are the result of a change in circumstance, potentially tied to a change in income and things like that. So that can be really jarring. Sometimes it's great, sometimes it goes the other way, and you see a change that you're really happy with, especially with those lower income steps. But those changes, especially sounds like for that Medicare one, that was really jarring, and that can happen to consumers, and those are hard conversations. I am going to let Kim chime in, and I think she's probably going to be our last one here, because Nick and I have kept you all for 90 minutes. And I really appreciate everybody sticking with us and participating. I think that I really hope that this was useful for everybody.
I just wanted to say that you can take the lead spouse off of the application, you know, to put for the main person, but you still have to have them on the application for their income, because they're still a taxable household. So
That's a really good point.
just keep that in mind when doing that.
Yeah, I really like that point, Kim. Thank you for that. Because yeah, you're still doing the application. You still need to count the household,
Yes,
right?
because
So
they're
you
still,
need, yeah.
yes. Yeah, so we just don't want anybody to take them off.
Yeah, yeah.
Hey, we heard that this is how we're doing it. So
Yeah,
just
that'll give you a price change for sure.
yes,
Yeah.
just for that clarification, remember taxable household. This was
Yeah.
a great webinar. Thank you, Adam.
Oh yeah, no, thank you for saying so. Thank you for chiming in with that. No, really, and it never ceases to amaze me how much of a hot topic, because the Medicare piece of ending coverage becomes in a conversation amongst the sisters, because it does not make sense. And no matter how many times we talk about it, we can't reconcile that.
Yes, we just had a comment of, you know, it can go either way. Sometimes the premium gets lower, sometimes it goes up, and it would be nice to know why that occurs so we can have some sort of semblance when we talk to consumers. But unfortunately, I think that's one of the things that they keep behind the curtain, like the actual APTC formula.
Yeah. Well, yeah, no, thank you, Kathy, for that. That's great. And Nick, you nailed that math question in the Q&A too, now that I can see them. I appreciate actually you keeping up with all of that. There were lots. Really great questions, everybody. Thank you all for your time today. Really appreciate your participation. We'll get slides out, we'll get evaluation out, and any information that we said we would cover, we'll try to get to you guys too, if not through the follow-up email, through our listserv as well. Again, thank you all for joining us. Really appreciate your time. I'm going to stop recording. Take care and have a good rest of your week.
Thanks, everyone.
Thanks, Nick. Really appreciate your help on this one.